Good morning, everyone. My name is Dara Blackman-Demner. I'm a program director here at the National Institute of Nursing Research in the Population and Community Health Branch. I have the privilege of welcoming you all to our Advancing Nursing Research to Support Healthy School Environments for All meeting, co-sponsored by NINR and the NIH Office of Behavioral and Social Sciences Research. Next slide, please. Today will consist of some opening remarks and a keynote speaker, followed by a series of panel presentations and discussion. We will have two short breaks, one around lunchtime at 12:20 and the other in the mid-afternoon. We hope that you will be able to stay with us throughout the day, but we understand if people need to come and go. If you do need to leave and are able to return, we invite you to join us around 4 p.m. for a final facilitated discussion with as many of our speakers from throughout the day as are able to stay. Next slide, please. This meeting is being recorded and portions will be made available on the NINR website after the meeting along with a meeting summary. You may notice that the chat has been disabled for this event. We will be accepting questions via Slido, which I'll show you on the next slide, and you may submit those questions at any point during the meeting. We will do our best. We may not be able to get to all questions, but again, we encourage you to submit them at any time during the meeting. For technical issues or concerns, please contact John Hare, and his email is listed there, as well as on other slides throughout the day. Next slide, please. Again, this is the QR code that you can scan, or you can just go to slido.com and join as noted below. We will be showing this slide periodically throughout the day if you're not able to catch it now. Next slide, please. Okay, now it is my great pleasure to introduce the Acting Director of NINR, Dr. Courtney Acklin, and Dr. Jane Simone, the Associate Director for Behavioral and Social Sciences Research at NIH, and they will both give some opening and welcoming remarks. So first, we will hear from Dr. Courtney Acklin. She is a dynamic leader currently serving as the Acting Director at NINR. Throughout her career at NIH, which spans more than 15 years, she has demonstrated a strong commitment to strategic leadership and effective management. Working collaboratively across the NIH, the federal government, and other allied organizations, Dr. Acklin serves as an ambassador for the Institute, communicating NINR's vision and facilitating the advancement of nursing research. And then we will hear from Dr. Jane Simone, the Associate Director for Behavioral and Social Sciences Research at the NIH, as well as the Director of the Office of Behavioral and Social Sciences Research, or OBSSR. With over 30 years of experience, Dr. Simone's intervention research has examined behavioral aspects of chronic illness, evaluating strategies to promote treatment engagement and improve health outcomes. She's led more than 24 research projects, and 2 of her strategies to promote medication adherence, peer support, and electronic reminders are included in the Centers for Disease Control and Prevention's Compendium of Evidence-Based Intervention and Best Practices for HIV Prevention. Dr. Simone has collaborated on research and training awards on HIV, mental health, substance use, cardiovascular disease, diabetes, and pediatric overweight treatment. So I will turn it over now to Dr. Acklin. Thank you.
Good morning, everyone, and thank you for that introduction, Dr. Blackman-Demner. I'm delighted to welcome you all to this timely meeting on advancing nursing research to support healthy school environments for all. At NINR, our mission is to promote and improve the health of individuals, families, and communities through innovative nursing research. Nursing science leverages this unique person-centered holistic perspective of nursing to support solutions-oriented research that addresses real-world health challenges within the context of the conditions of people's lives. This year, we're excited to have identified school health as our strategic imperative, recognizing the immense potential for nursing research to advance both school health research and practice within the school and in the broader community. Nurses, as the trusted health professionals, are ideally positioned to bridge the gap between education and health, fostering research that promotes educational success and health for all youth. With this focus in mind, today we have 2 primary objectives. First, to showcase NINR's commitment to supporting rigorous, innovative research that promotes healthy school environments and chronic disease prevention for all students. 2, to foster dialogue among school health researchers from a range of disciplines and school nurse practitioners, identifying gaps and opportunities for nursing research to advance the science and practice through elevating the leadership role of school nurses. But to meet these goals, we have an exciting day planned for you that includes a mix of panel presentations, as you heard Dr. Blackman-Demner say, and discussions. Our agenda is planned to reflect Nursing Holistic's approach in our conceptualization of school health. Specifically, we are considering not just the school environment, but also the broader community context. You'll hear from researchers and practitioners working within the schools in surrounding communities and neighborhoods, and those creating vital connections between health and educational interventions and outcomes across the lifespan. We're particularly eager to hear from a panel of school health nursing experts who will share their thoughts about translating existing scientific knowledge into practice within school settings and to identify future research opportunities. Throughout the day, we encourage your active participation as we've built in ample opportunities for all of you to share your questions, thoughts, and ideas. We need your input as NINR strives to identify the critical next steps for nursing research to move the school health field forward in the service of promoting health and educational success for our students. Thank you all for your commitment to this vital work. Let's make today a catalyst for meaningful progress in school health research and practice. But before closing, I'd like to acknowledge again our colleagues at the NIH Office of Behavioral and Social Science Research for their collaboration on this event. So I will now turn it over to Dr. Jane Simone, the UBSSR Director, to share some welcoming remarks. Jane?
Thank you, Courtney. Good morning, everyone. Welcome to the workshop. I'm honored to be one of the ones getting us started. The office I direct, OBSSR, was mandated by Congress in 1993, and our mission is to coordinate at NIH the health-relevant behavioral and social sciences and to identify challenges and opportunities to advance these sciences at NIH and beyond. Our vision is a synergistic integration of behavioral and social sciences and health research, which we believe will lead to accelerated scientific discovery, more effective treatment, better health promotion and prevention interventions, and implementation strategies, most importantly, that will improve health for all. We are proud to partner with our colleagues at NINR at this event, as OBSSR is committed to advance our understanding of how individuals, families, and systems such as schools can operate synergistically to improve children's health. We share NINR's focus on chronic disease prevention, particularly through multidisciplinary approaches to whole person health. The school setting is such an important yet understudied context for health and development for children. It's also near and dear to me personally because I conducted my dissertation research in the public elementary schools of Los Angeles, where we developed mutual support groups for Mexican American parents to empower them and enhance their engagement in their children's schooling. Supportive, high-quality environments set children up for healthy, successful lives. Critical evidence gaps persist, however, around creating these health-promoting settings, as well as real-world scale-up and sustainability. There's much more work to be done and to develop pathways to advance school health and improve health and well-being for all children and students. I'm excited to take part in this workshop and learn from the perspectives we've gathered here. Thank you all for joining us. And now I'd like to turn it over to Shalonda Bynum from NINR, who will introduce our keynote speaker for today.
Thank you, Dr. Simone. Good morning, everyone. Again, my name is Shalonda Bynum. I am a scientific advisor at the National Institute of Nursing Research. I'm honored to have the opportunity to introduce our keynote speaker for today's event, Dr. Erin Mon. Dr. Mon is an associate professor in the School of Nursing and executive director of the Center for School Health Innovation and Quality at George Mason University. Erin is a leading expert on school nursing and child health with over 2 decades of experience as a frontline school nurse consultant, and school nurse researcher. Her research involves examining the role of infrastructure and policy on school nurse staffing and services. Dr. Mon previously served as Director of Research at the National Association of School Nurses, where she co-led the development of a national uniform dataset for school nurses, school nurse indicators, and creation of the National Association of School Nurses framework for 21st century school nursing practice. Dr. Mon will spend about 30 minutes presenting the topic, Advancing School Health Through Nursing Research. Thereafter, we will have about 15 minutes for Q&A. So as you are thinking about your questions, as Dr. Blackman mentioned, please enter your questions via Slido, and we will remind you at the end of this segment how to do that. Dr. Mon, I'll hand it off to you.
Wonderful. Thank you so much. And thank you for this opportunity to speak with you today. School nursing, as you heard from my bio, I've been around a long time, basically, is what it says, and particularly working in school nursing, which is my love and passion. If you can go ahead and go to the next slide. What I'm going to do today is talk to you, kind of lay that foundation and framework to kick us off regarding a little bit about what has been alluded to of how we can really advance the research in school health, and particularly in school nursing. And by doing that, I'm going to kind of go backwards to have us be able to go and move forwards. And I'm going to do that by using and organizing my presentation around the idea of anniversaries, and particularly the 40th anniversary, which was my understanding was with NINR. I know it was mentioned that also it's the 30th anniversary of the other institute, which is fantastic. But there's a couple things really specifically that happened in 1985, which is 40 years ago, that really I think are important for us to understand and beyond historically, that I think will really be helpful in helping us understand school nursing and school nursing research. So that's how I'm going to organize it. And I just thought it would be a little fun to give that historical perspective as we move forward. So if you can go ahead and go to the next slide, please. So actually, and this was a really important thing, in 1985 was actually the inaugural year of the Journal of School Nursing, which is the research journal for the National Association of School Nurses. Now, before that, there was a newsletter flavor version of the Journal of School Nursing that was called The School Nurse, and that's what this picture is showing here. But in 1985, it became the Journal of School Nursing. And this was a really important part because it had a new cover, there were author guidelines, peer review process, and that's where the research began. And Jan Dennehy, who is a former editor of the Journal of School Nursing, she actually wrote an editorial that kind of reflected back on the first 25 years of the journal, that I was able to pull some really key information about some of the first research that was done that I think will be really helpful today. Now, I do want to say that I'm focusing on the Journal of School Nursing, partly because this is about advancing nursing in school health. But I do want to say that there is the Journal of School Health that I know many of you are school health researchers, and you might think, I'm not ignoring that journal. It's definitely an important and scholarly journal that also publishes research on school health as well. It's just that since we're focusing on nursing, it fit well with the Journal of School Nursing. So let's talk a little bit about this. So looking back, and what Jan did an analysis of what some of the topics and interests were with the Journal of School Nursing. Way back, it actually started in 1980, and the topics I thought were actually that were relevant at that time focused on obesity and junk food in schools, something that is still relevant today and are still issues of the day. In 1984, they had a special issue that focused on students with disabilities and special education, and particularly with an emphasis on legislation changes that were needed to help support students in schools with these special needs. In 1985, with this new look, and like I say, as it changed to the Journal of School Nursing, they actually spoke about some of the other emerging conditions that were coming up, including AIDS, and how did that impact schools. And in 1987, I thought it was interesting that there was a special issue on school-based health centers. So I bring these up as topics because they were very relevant then, and they're still very relevant today. I also want to share, if you can go ahead and go to the next slide, that I want to talk about one of the leaders, and this was back in, she actually published this in 1980, so a little bit before, but is really important, I think, as you can see from these quotes. Dorothy Oda, she was a well-respected leader in school health and was the nursing director of the Robert Wood Johnson Foundation National School Health Program that existed in California. She wrote a forecast for school health, and in it she wrote about the need and effectiveness. And I'm bringing this up now because, gosh, if this was quoted in this day and age, I think it would still be very much relevant today. As she says, the focus of school health services will depend upon the strength, image, and effectiveness of school nursing. This is probably the single most important issue in school nursing today, the cost benefit of its service. I would like to say too, as we're talking about, and as we talk and progress about the through the day related to research, is we're going to talk about a lot of topics because school health covers a lot of topics. We're talking about school health, but it's really the health of the school-age child. And because children are not one-dimensional, but multidimensional in that holistic approach, which is where I think nursing is so important, it also makes school health quite complex. But within that is understanding what that role of the nurse is. And I think it's still something that is not completely well understood. And in the recent research still shows that there's still a lack of understanding in what the role of the school nurse is, especially in this day and age. So for her to say that back in 1980, I think is really interesting that it's still an issue. And that same issue, which was actually in September of 1980, she also shared one of a study that they had done, which looked at the role of the school nurse in follow-up of dental screenings, which we oftentimes might not think of, but is one of the roles and is part of school health because, again, health is in the broadest sense, physical health, social health, behavioral health, oral health, all of that. And in this study, it showed that 1/3 of when a school nurse did the follow-up, nearly 1/3 were more verified care than the control group of when there was not a school nurse helping with the follow-up and needs of the children. This is one of the actually first and earliest examples of research that demonstrated the effectiveness of school nurse care. And again, it was in 1980. Bringing that up as we move forward, some of you might think that wasn't very long ago. Some of you might think it was very long ago. We'll see. But in the grand scheme of things, you can see why school nursing research is in its infancy. And I'll continue to share a few examples. She also shared in this particular issue also another pilot study that was near and dear to my heart because I was a school nurse in Utah. And it was about a school nurse practitioner program that they piloted in just 4 states, Colorado, New York, North Dakota, and Utah. That was to enhance the care delivered to children in schools, looking at the independence of school nurses. The pilot study went well. From my understanding, this was before my time, but at the same time, and it was actually talked about when I was a school nurse in Utah, but the school nurse practitioner program did not last long. And it was kind of my understanding morphed into other programs, but we do not have a particular school nurse practitioner, advanced practice nurse. They might be a pediatric nurse practitioner, but they were piloting actually a very specific role as a school nurse practitioner, which I thought was really interesting and innovative, which is why I wanted to highlight it. So up until that was 1980. It wasn't until about 1993 that it was very sporadic that even though this was the research and evidence-based journal, that there was actually research published in the journal. Oftentimes it was more calling for the need, and it was evidence practice-based, which is also very important. The research that was there is usually very focused on chronic conditions as well as the issues of the time. In 1983, it was one of the first studies that looked at different levels of care between school nurses that worked in elementary school versus in middle school versus in high school, and what the nursing functions were related to nursing diagnosis, counseling, and the referrals of student absences. I thought that was interesting, again, in the day and age that we are living in now, where chronic absenteeism is a huge issue in schools. School nurses could have told you that way long ago, and probably earlier than 1993, but it was part of a study back in 93. Also, interestingly, in 1993, there was a new section of the Journal of School Nursing called Information Management and Computer that it was talking about the use of information and computers in the school setting. I bring this up because Dr. Martha Dewey-Bergen, who is going to be a panelist later on, was one of the co-section editors of that, so was a pioneer right from the start. In 1995, there was another, what I would call a sentinel article and research that was done that looked at the relationship between school nurses and child well-being. Now, there were some, maybe, I'm not sure, I'd hate to call it flaws because it's a really important article because it was the first that really looked at child well-being index, but it used ratios. It wasn't able to account for some of the things because of some of the data that was not collected at the time. But it started looking at some of those positive aspects of children, and that's why it's so important. But then again, in 1998, the editor of the Journal of School Nursing, Susan Proctor, again spoke to school nursing research and do what we really need, and the push for needing more research, specifically not about the conditions, because that was coming out and it continues to come out, but really looking at infrastructure and that what is the research related to the infrastructure of school health and school nursing, which will continue to be kind of a concern that there wasn't a lot of actual research on that. If you can go to the next slide, please. So again, just kind of giving some historical perspective up to this point. So then I thought, well, where are we now? So what are the trends? So thanks to our current Journal of School Nursing editor, Dr. Mayumi Wilgerodt, who is also a panelist later on today, she contacted SAGE, who is the publisher of the Journal of School Nursing, who was able to provide some data looking at the current trends from January 2014 up till April 30th of this year, and what are the focuses on? Because I think this can really be helpful for us as we're looking at where the research is and where the research needs to be as we move forward. As you can see here, the focus has been really evidence-based clinical and psychosocial needs of school-age children, particularly looking at professional practice issues of school nursing. And that is a wide range. I know that's a very broad subject. When I went in and looked at some of the data they shared, it's very broad range. A lot of their are articles that look at the role of the school nurse in a particular issue, or looking at what the school nurse's understanding of particular issues are in their practice of a particular issue, like a chronic condition or whatever issue of the day is. And then the other research focuses on mental health, chronic conditions again, and some of the common topics that are published on in the research are related to health promotion, school safety and violence, access to care, and sexual health. Again, as I mentioned, as we think of a school-age child and all the concerns and issues of school children, these are just listing the common topics. Many more are published. I'm not saying that at all. But if you look at the recently published paper by NINR about the priorities, you can see that these are covered, but there are other topics that are not covered. And I think this is kind of common as I looked at this historical perspective, that oftentimes the research did look at the crisis of the day, is what I kind of call it. And that's really important. We definitely need to, of course, with COVID, we've seen a lot of publications related to how did COVID impact school? Very important. We need to know that. There's always a crisis. There's always a concern that we need to address. And yet at the same time, there are gaps. And those definite gaps, I think, is what is really exciting about this summit. And as we look at having a more structured, thoughtful look of moving forward, of really looking at that school-age child and where are the needs. And that's kind of what I'd like to talk a little bit about next. There's a group of us that, if you can go to the next slide, please. A group of us that are in the American Academy of Nursing. We've been looking at and it's specifically about the school-age child. That's kind of my area and passion in our group, but we all come from very different perspectives. There are a group that really focus on the environmental perspective. There are members in the group that look more, they're very focused on the mental health perspective. We all have our different passions in that group. But we realized that there's been a lot of what I call evolving understanding of the school-age child. And have we accounted for that in how we address not just school health, but also just in the healthcare system of children? And that's the work that we've been doing with the Academy. And I think some of that is really relevant here and fits well with what NINR is doing and how they got their priorities. So I thought it was important to cover some of that. School-age children are not just small adults. And so just addressing them as small adults isn't really going to work. And we oftentimes have focused on the crisis or the gap. But if we pause and really look at what the evidence has said, a lot of evidence has really evolved regarding the school-age child. And have we incorporated that into school health? And I think in many ways we have, but have we incorporated that into the research of what makes an effective school health system? So what I'm talking about is we have an increased understanding of brain development during these years, physically, socially, the neuroplasticity of the brain. Have we really understood that well, and just that life course approach to health, that these years are critical? It's not just those early childhood years. We know the evidence there is really clear, and that is really important. And then we've historically kind of jumped until they become adolescents and just to put it bluntly, either on a substance or pregnant. We then work with them because they're in a crisis mode again. But all those years, we've kind of just like let them move along unless there's been a concern. But it's a great opportunity that we shouldn't just let them move along. There's a lot we can be doing. And the research that shows about adverse childhood experiences, we know that those years are critical years from that trauma. But there's also emerging evidence and great evidence about positive childhood experiences, and that both need to be addressed because they both impact the safe and supportive environments. If we can have that safe and supportive environment, if we look at it, the caring adults that are in their lives, and then the positive childhood experiences also look specifically at that supportive school climate, safe neighborhoods, engagement in social and recreational activities, the importance of meaningful opportunities for personal growth and achievement. All of that on that positive side, as well as addressing the concerns from adverse childhood experiences, the research has shown in both ways they impact the physical and mental health of the children, not just at that time, but throughout their entire life, their adult life. And as we look at the mental health crisis that we know we're having currently with children, but again, through adulthood, taking and looking at this life course approach is really important and is an important part of looking at the school health and looking at school health, not just as addressing the crisis of the day, but looking at it from this life course perspective. So what does this mean then specifically with nursing? So again, our group was looking specifically at nursing, but going a little bit deeper into that. And if you can go to the next slide, please. I'd like to then now incorporate specifically why nursing and how can nursing research really help advance school health? And we have to start with, of course, the Future of Nursing report, which highlighted school nursing, I think, for this reason, because they saw that, but also beyond that. And this idea of the ecosystems of a school-age child or any person, we are made up of a lot of different ecosystems that we touch base with. And nursing, that holistic approach that nurses take, we see those different ecosystems, and there are nurses in each of those ecosystems. So working as nurses across the ecosystems, I think, is just part of what we do naturally and is a great contribution that nursing can make. Also, nurses, although we definitely address gaps, I think more and more are looking more at a strength-based approach. And so as we look at the unique contributions that nursing can make, it's that strength-based and not just looking at weaknesses. Also addressing health promotion and prevention. Again, the school-age child is a great opportunity to look at prevention, promotion. The World Health Organization is doing more and more looking at the role of schools because they see that as a great opportunity to promote and prevent issues of adulthood because they know it can be addressed earlier. And then I think in nursing too is a culture of innovation, which I'll talk more about later. But I think the Future of Nursing really talks about that. And Dr. Ashley Darcy Mahoney, who's also on the call today, was a huge contributor in writing with the Future of Nursing report and others as well. And I think that it's really important to really see that this role of nursing just comes out really strongly. And I know in my circles, as this was coming out, we were talking about, well, what is that uniqueness of nursing? And I've highlighted some of them, but I think it's even more than that, because I think you'll look at other professions, and I know there are other professions on the call and on the panel, and to say that they don't do some of this, I think is not necessarily true too. And in school nursing, some of the things we do related to some of the community needs that a school-age child might have, for example, related to food insecurity, or if they're living in lower socioeconomic areas and there are issues with housing or getting access to medication or things they need. It's not just the nurse that can do that. There are definitely others that can do that. But I think what the nurse can do is bringing that care coordination together. And as we talked with my nursing colleagues, it's understanding that role. And there's a definition of nursing I'm going to share in a minute that I think brings that well together. Well, I guess we can actually just go to that. If you want to go to the next slide, the American Nurses Association actually has this definition of nursing that I think it's a diagnosis and treatment of the human response and advocacy in the care of individuals, families, groups, communities, and populations in recognition of the connection of all humanity. And that specifically that part about the treatment of human response. I'm currently attending the International Council of Nurses meeting, and the other day they talked about that nurses are the champion of people-centered approach. And I think that's one of those unique contributions that nursing can take, and why, as we're looking at advancing the research in school health, nursing as leaders are such an important component of that. I've been talking really high level, but just as examples of this, just recently, as I've talked to various school nurses, I can think of the school nurse who brings it all together, where talking to the family about their student who is having a variety of health conditions. They'd been to a provider, they weren't sure, they were trying different treatments, it wasn't there, but the school nurse put several of the signs and symptoms together and realized that maybe the diagnosis hadn't been found, and actually suggested they go to a specialist. And unfortunately, the student had leukemia, but they weren't even looking in that area because it hadn't crossed the parents' mind. And I don't know the full story. I don't want to speculate anything, but the nurse in that holistic approach of bringing and listening to what the student said and listening to what the parents said, and seeing themselves the different signs that they were noticing at school, was able to look at that whole picture and then provide nursing diagnosis to help provide them guidance of where to go, and then got the specialists and the need for get the diagnosis needed. At the same time, it's not just about the diagnosis. Other things, such as I mentioned, many times nurses will help in getting care. I was talking to a colleague who was a school nurse, who parents were trying to get their child, needed to see a specialist, had gotten their referral, their insurance was covered, but had been trying for weeks to get their child into the specialist that was needed. And just, they talk to this person, etc. Well, the nurse was able to call and explain the situation, and something that had taken the parents weeks, hours on end, the school nurse had it figured out within a week to help get the right person, because they were able to explain it and was able to talk nurse to nurse and get the right specialists in care. Those are the kind of things nurses do. But it's not just with health. That's the role of the school nurse on the health perspective, but school nurses work in academia too. And with chronic absenteeism, a big part of what school nurses do, looking into the situation and finding out that a student was absent for, it wasn't even for a health reason. It was the student was in kindergarten, and the mother had young siblings at home, and it was really cold, and the bus stop was too far away, and she didn't feel comfortable having the child walk by themselves to the bus stop, didn't have anyone around close that could walk them. The nurse was the advocate to get the bus stop changed. So it's not always just health as in the traditional sense of health, where the school nurse makes the difference to get the child in school, which is an attendance issue, so that they can learn. School nurses do all this together, and they bring it together because they're the champion of people-centered approaches. And that's why, as we look at advocating for the role of the nurse, I think is so important. And that's why I think we're here today to look at that role. If you can go ahead and go to the next slide, please. So back to 1985. I thought this was and this isn't a school nursing example, but it's back to innovation, which I think is such an important part. And I could go on and on, but this isn't about what school nurses do. This is about school nursing and school health research. But as we're looking at research and the role that nurses make, I think it's an important part that we bring in this innovation. So back in 1985, that was the year of Live Aid. And just as to recap for those not familiar, there was a famine going on in Ethiopia. And so they raised quite a bit of money through this Live Aid concert. I didn't know until I was searching about 1985 for this presentation, but did you know that that was all inspired by a nurse? And it was Claire, and I don't know how to pronounce her last name, but it's written there on the screen. She became a dame because of the work here and other work that she did. She worked with a lot of population. She was an amazing person. But what happened, she was a young nurse at the time, and where she was stationed is that she was the one who decided who would get fed and who would not. And she ran a feeding center that accepted only about 60 or 70 children at a time, although there were thousands that needed to be fed. And she was the one that had to make that decision. And she saw people around her that needed the help, and she couldn't give it to her. And she was being interviewed about the pain of having to make that decision herself. And a quote that she said was, "I felt like a Nazi commandant, deciding who would live and who would die. And playing God broke my heart." She was interviewed by the BBC, and it was seen by Bob Geldorf, who launched Band-Aid BAN space AID, not the plaster Band-Aid, which then led to Live Aid, which raised 150 million pounds and saved an estimated 2 million lives in Africa. All started by a nurse. And you might think, well, that it wasn't even a nursing intervention, but I think that's the beauty of school nursing and nursing in general. It doesn't have to be a literal physical intervention, although oftentimes that is what nursing does. But school nursing, I think in particular, in some of these, we think outside the box because it's really about that people-centered approach and what's needed at the time. And it's not always that we do it ourselves, but speaking up and seeing the need and getting that need taken care of. So again, because we're doing 1985, I just had to throw that in with innovation because I thought it was pretty cool. If you can go ahead and to the next slide. Also, what else happened in 1985? The movie Back to the Future. So let's go back to actually the Back to the Future of where school nursing started, because that brings it back to, again, research and where school nursing started actually as an experiment, they called it. What happened? It was chronic absenteeism again. Let me just set this up. I know some of you might know this story, but I think it's such a critical part. And as we're looking and launching things forward, I think it's a good place to go back to better understand. It was in New York City. And at the time, school health existed, but it existed with school physicians who came into the schools to do screenings and exams. Now, it was 1902, well, 1901, in turn of the century. And in the area in New York City where they were, there was a lot of children who were living in very socially or socioeconomically hard times. And in this area in particular, and it's an important part of the story, it was children that came from all over the world. They were immigrants that came, and so they spoke multiple languages. And that's an important part of this story. And what they were finding by the school physician was that many of them had basically an eye infection, and so they were being excluded from school. Well, the idea was they'd be excluded from school. They were supposed to get it treated and come back. They weren't. They were like gone for months because, and what was happening is they'd see those kids playing on the streets with the kids that were maybe not excluded, but it was being passed along, and kids were being out of school for a really long time. So it came up at a board meeting, and a public health nurse, Lillian Wald, spoke up and said, hey, let's get some nurses involved, and I bet we can address this situation, because there's more to it than just the exclusion of school. They realized that there was a non-understanding of why they were being excluded and what to do to get them back into school. And it was an issue not just of the eye infection, but of the cramped housing. Parents were stressed, and they didn't understand what they were to do. So hence, if you can go to the next slide, the 1-month experiment. It was in October of 1902, one nurse. She was assigned to 4 schools. Her name was Lena Rogers. And she found out the students that were absent, what was going on. During school, she did some education, but after hours, she would go to the homes and she would do community education as well. I think this also shows the role of the school nurses, not just being in the schools, but it's working with the whole families. In October of 1902, there are the numbers, 10,567 students were absent. Within a month, it changed, but the numbers from the articles actually didn't show until September of 1903, so it was a year later. But after that 1-month experiment, it clearly was so well that they hired more nurses. But within a year, you can see the absences had come down to 1,101. The experiment worked. And the fact that they oftentimes call this an experiment, if you think about it, school nursing started as a research project that worked. And so as we come now to where we are, where we know school health worked then, we know school health works now, but where are we from that research perspective? And if you can go to the next slide, that's where I'd kind of like to wrap up. So hopefully this historical perspective has given you some understanding of where things are and maybe why things are. Excuse me. There's been some really good work done, and in no way do I want to say there hasn't been. But I feel like as I reviewed it myself, I saw some ahas, and that's what I'd like to share, my final observations of what we need to do to really advance school health and nursing research. And some of these things are things that would advance other areas of nursing research as well, not just in school health, but I think school health is a great place to start. And so that's what I'd like to kind of go over now. So we need to get beyond the crisis of the day. Now, that's not to say crises aren't important, and we do need to address those. But I think we need to start with the foundation. And this image of the bridge kept coming to my mind. Bridges look different depending, and I am not an engineer at all, but I have a coworker whose husband is an engineer who in school used to always, his professor used to always say, you don't get half credit if the bridge half works. And so I think we need to think of like, we don't get half credit. And I don't think nursing school health has, well, what I do think actually is that school health hasn't progressed and is still in the infancy because we haven't laid the strong foundation of what school health is in regards to the research and the outcomes and the data. We have addressed the crisis of the day, but oftentimes from people coming in to address the crisis and not addressing the actual the school health system that's there. Julia Lear oftentimes talked about it as the hidden healthcare system. There is a healthcare system in the schools that oftentimes researchers come in and don't really participate in. And so when researchers have come in and don't include that, it's not a sustainable model moving forward. We need a sustainable model of school health, and that needs to be researched. I think that's really important. And so that first thing about integrating models of care, and I'm not saying there has to be one. I think there could be multiple. In fact, I really think there is, because there are different needs in different communities. I think we need to research the current models, plural, that are out there to find the ones that are most cost effective, that work the best, and that there are going to be different ones in different areas. And I'm going to say this, and it's going to sound contradictory, and I acknowledge that, but I don't think it is. And at the same time, I think we also need to look at new ones. What is new? What is innovative? What's going to work differently? We know that there's telehealth, and there's some great models, and how could telehealth and other things be out there? At the same time, though, when we're bringing things in, we need to think about what's going to be sustainable moving forward. And in a world not just of health, but remembering that school health overlaps with the world of education, which has a different culture than the world of health. And those of us that work in that really understand that. But my observation, and as I went through and looking at different articles, I've been in a group that is developing some guidelines with the World Health Organization on implementation guidance of what works for getting school health services to be implemented in schools. And that nuance between school health, or health, I should say, and education is so crucial, but they are such different worlds. And if people don't get that, then things don't work. And I think that's true in research as well. So we need to look at these integrated models and see what really works and be open to new ideas of what that is. And then I also think we need to look at the delivery services. So models are one thing, like how it's, but then also just how it's delivered. And it needs to be co-designed. This is where as I alluded to before, people outside might come in. And as we were looking at some of the articles for this WHO work, we had to exclude, and it was just really interesting to look at the number of research articles that came in that they wanted to come and do this thing, but they didn't talk to the school nurses or the school social workers or anyone that worked in the schools. And yet in research nowadays, we always talk about co-designing, and we talk about the need to include youth because we're talking about children, right? Which I 100% agree on. But we also need to co-design with the school nurses and not just have them participate in the research, but be part of the research because they understand these nuances. And think of it as almost like a cultural sensitivity. We would not go into a culture and just demand that they do it the American way. Well, why do we do that in school health? We need to understand the culture of school health. And not that it's not open for changes, but we just need to make sure, because again, if we're going to be doing research, let's make sure that it's research that's sustainable research and not just something that's really great and creative, but that's not really going to be something that's doable moving forward once the research and the funding ends. So I think that's...
we have about a minute left.
Oh, got it. Okay, I won't go in. So thank you very much. Just looking, let me just, with that, I think I've, so, and the other one I want to just say is, and the collective impact. So I think this is one thing, and this goes back to the next bullet of school health and nursing outcome measures. I think we really need to get some really agreed upon measures that we can use across, not just in school nursing, but about school health. Dr. Wilgero actually did a scoping article about school health generally and the various components of school health. And this is an area that we have major gaps in. We need to be working together on that. I already mentioned like while we need implementation science research for sure, I would just add on, make sure that in addition to being able to implement it with fidelity, that there are things that we can be sustainable on. And then this is not an afterthought. I wanted to make sure those were highlighted because these things I've mentioned are gaps that I think are the reasons why school health and school nursing research has not moved forward and is still in its infancy. But then I think this is where nursing shines is the last one, that nursing impact on students and really being able to find the students that live in vulnerable situations and really helping them, but not just at the gaps, and really looking at resiliency and protective factors and how can we make sure all children have the opportunity to thrive. So that's where I think we can really move things forward. And I just always like to end things with a quote. And so here's the quote as I end this section, that our children are our hope for the future, but we are their only hope for the present and their future. And I think school health has a lot to do with that. So thank you for this opportunity.
Thank you so much, Dr. Mon, and thank you for the quote. I like quotes. I think it helps to set the stage and also conclude the presentation. It kind of wraps things up. And thank you for the history lesson, for taking us back 4 decades to the trajectory of school nursing. So thank you so much for that. So we are going to move into the Q&A section, segment of this segment. If you have questions, please enter those questions via Slido. So you can scan the QR code on the slide, or you can go to slido.com to enter your question. So while we are waiting for questions to come in, I will take the privilege of asking the first question. So you talked about at the beginning of the presentation kind of the challenges with school nursing, and you also wrapped up with that and why school health hasn't advanced in the way that it should have. Why do you think that the evolution of school health and the science has not been able to move past those stumbling blocks? Like, what have been the challenges? And I really like the analogies that you provided in terms of kind of the holistic perspective of nursing and strength-based. But like some of these things we have known for decades, right? Almost 4 decades, and we are still encountering those challenges now. So why and what do you think is needed to move past those?
Yeah, great question. Been on my mind a lot, and in my own career as well. I think taking it from 2 perspectives. I think from the research world of not having strong agreed upon outcomes, and outcomes not just from the health perspective. We have the chronic conditions; those are pretty clear cut because each chronic condition, its management, those we understand. But because school health is also in the world of education, we need outcomes that educators understand because they're oftentimes the decision makers. And so having some outcomes that are really clear and agreed upon, we have not advanced that. And because they're complex, I don't think it's an easy answer, and that's why we haven't. So I think because of that, and without outcomes, it's really hard to do a lot of the other research regarding what are the best models. You've got to measure it off an outcome or something. So I think those are some of those challenges of moving things forward from that perspective and looking at it from the infrastructure. I think the other thing, though, is because it doesn't fit especially looking historically at some of the traditional ways of doing research of the experimental model, and that's oftentimes how funding has been done. The funding to look at some of these areas has not been there. And so that's why I think I'm very excited to see that NINR and NIH is looking and sees it as a priority. And I think we have evolved in methodology in ways that we are more able to measure now some of the things, because it's not your typical RCT type study in the same way. I won't go into methodologically a lot. I mean, we can do it. I don't mean that as an excuse, but the methods of how to do more population-based approaches has evolved that we need to use in school health. And so I think those 2 aspects, you bring them together And that's why school health has not advanced as we've needed.
Thank you for that. So let's move on to areas of research. You suggested several areas of research, one being methodology and being outcome focused, et cetera. If you had your wish list of the top 3 areas that you think will really make a difference in advancing not only school health, but improving, which is what this is about, improving the health of children, what would those areas be?
Mm-hmm. Oh, good question. I definitely think one area has to be about the infrastructure and the delivery model. I'm going to put those into one because I think as I've looked historically and just my own, and I know I'm biased because this is an area passionate for me from my own experience, that seems to be the part that oftentimes is overlooked. There's been a lot that's looked at conditions, but if you don't look at the context, it's not going to advance the health of children because we don't have the context. And I think if we want to really look at school health, we've got to look at that infrastructure and the healthcare. So I think that's really got to be one of the priority areas, and that co-designing of things and looking at it that way. I think a second area, because I'm thinking methodology, is again, with outcomes. I think we've got to really get strong school nursing and school health outcomes that are standardized and that we can use. And with that is, with methodologies to collective impact, because I think to say that the school nurse alone does something or that this one person is the only one, even though nursing is holistic, I think we also realize we're not the only ones involved in a child's health. And so I think looking in advance, I think we have a great opportunity as in nursing research to advance like collective impact. And what are those methodologies that better measure nurses' roles and nursing value? I think that's an area. While also, and I think with care coordination, there's a lot that can be done that we haven't gotten the methodologies quite right in regards to this more population-based approach that school nurses take in their role. I'm not saying we don't have it in other areas, but I think that's, if we could really focus in on those 3 areas, I think we would advance the science in so many ways in school nursing and school health.
So next question, you talked a little in your presentation and just mentioned it again about the importance of co-design, understanding that school health is multidisciplinary, and especially thinking about kind of the broader ecosystem in which children live. What sectors, so you mentioned staff, but what sectors do you think are particularly important for this research?
Yeah. So when I was thinking co-design, I love how you mentioned that because it's making me think broader, which I love. So when I was thinking co-design, I was originally thinking just the co-design of the school health personnel, like the staff. But depending on what the topic is, if we want to think of that school health child and those ecosystems, then I definitely think we need to go beyond just the school health. I know some of the priorities that NINR has mentioned is like the after school programs. That has not been well researched, especially in related to the rest of the school health program. They're oftentimes seen as very siloed and different. I think the other thing is, if we look at it from that life course theory too, how do other activities or areas where children are interacting with health? And so I think that's where nurses in different settings, and not just nurses, I just think because nurses are in the different settings and with electronic health records, where it would be a great opportunity that we could look across settings and get that information ahead of time and get their input ahead of time, not just on their thoughts, and not just have them included in the study, but help understand how these different systems and ecosystems work together so that the design makes sense beyond just during the research, where things are more controlled, but that they'll be sustainable once the research ends. It can actually be something that could move forward and improve practice.
Thank you. Okay, so let's talk more about the kind of models of care. So you mentioned in the beginning of the presentation that nursing is strength-based and holistic and several other key principles of the discipline. Oh, what is the added value? What more can strength-based approaches provide versus focusing on a deficit model? What more can a holistic approach provide rather than focusing on kind of an isolated individual aspect of the person? And that kind of relates to the integrated model that you discussed earlier. So can you elaborate on that?
Mm-hmm. Yeah, what I think the beauty of both of those models is it includes everyone. To me, that's where I always loved being a school nurse, is that I had the opportunity that I wasn't working just with a subset of students, although those subsets are very important, and I think that's an important role of school nursing. But looking strength-based and holistic, even though we can do it in subsets too, is it's an opportunity to really look at your population-based approach of like your entire school population. And I think looking at that population and all children and their entire families, and what are the strengths of the children and what are the strengths of the families, it brings in interventions that maybe we wouldn't think of, because oftentimes and that's where I think that crisis approach has always been, because we always are looking at, oh, there's this gap we've got to fix, and oh, there's this gap we've got to fix. If we're looking at the strengths, then we're not looking just at where the like whack-a-mole of fixing the problem. We're looking at the beautiful strengths and this holistic, and how do we leverage those, not just in crisis, but always. And I think in that holistic approach, we look at maybe resources that we didn't look for before because we were always looking at the crisis of the issue. In work that I've done in other cultures and countries, I think that's where some of the beauty comes with like family-centered care, and how can families help. So it's not also on the role and shoulders of the school to do something, but how to leverage health promotion and prevention with families. And I know the evidence that shows with nutrition and obesity and things, you can't expect a school to fix a problem and have children not be obese. It's a community and family, and there's got to be that education and promotion and cultural changes. I think you pick any topic, and if you've got everyone working on it and you're building on the strengths and changing the culture to a health-based culture and that holistic approach, then so many it can be truly a culture of health. And instead of addressing the issue, you're addressing things very differently. And in that protective framework, a lot of the things address a lot of the gaps, but you're doing it in a more, it's the same issue, but you're also doing it in a way that sometimes people don't want to address a certain issue because they don't feel like it's a need, but there's oftentimes not resistance to being resilient and protective and promoting positivity. And so I think you also don't get some of the resistance, which is, having worked in pretty conservative populations, that's also very important.
Thank you. Okay, so I'm going to try to get 2 more questions in. So first question, can you elaborate on the importance of data and the potential conflict with outcome data? So you have outcomes that might be of interest to school administrators, and you have outcomes that might be important to researchers. So the conflicts there and how to resolve those conflicts.
Sure. So generally, when you ask stumbling blocks, I didn't bring this up, but I would say this has also been one of the stumbling blocks, generally speaking, of why we haven't advanced in research of school health, is we don't have good data collection mechanism systems like we do in other health. So I do think that's important to call out. There are electronic health records, but not, and that are school health based, but not all school nurses have them. There are different systems in education that don't have the same confidentiality and privacy components to it. And then sometimes it's the cost of things as well. So I think that is something that also needs to be addressed, not even from research, but just in documentation. Related to conflict, I'm not sure exactly what the question, I understand what the question is. I don't know if there's a certain part, but I do think this is a constant thing of privacy and confidentiality, and then different worlds of which in FERPA, which is the privacy policy for education, it's interpreted sometimes broader by educators, that they feel like they interpret it that they should have and understand more information about health than maybe the school nurse and school health personnel feel should be shared. For example, some of the mental health where there's stigma, maybe the teacher or principal doesn't need to know according to the school nurse, but they feel like they need to. This has been, I think there's a need for a lot of education and understanding. This is where these two worlds come together, and there's always going to be a need for building relationships of trust and understanding of how the data is used, what the data is used for. And the more that can be done upfront and being transparent ahead of time is crucial. From that research perspective, I think even more so. I was talking, I guess, more from the practice perspective, because it's a huge issue there. From the research, it's going to be even more a bigger issue because of the sensitivity of what some of that information is. At the same time, could some of that be done more at a population base where it's not going to identify any student? There might be ways that data could be shared, because I think it could be helpful for a principal or a superintendent to know percentages of certain things in their school population without knowing a particular student. So
Absolutely.
I think, but that goes to that discussion.
Yeah. Thank you so much. We are at time. We have several questions that have been unanswered. Thank you guys for engaging in the discussion. Thank you, Dr. Mon, for your enlightening presentation and the history lesson. And I really like the Back to the Future example. That's one that's certainly relatable.